West Coast. Yes, if you are in the West Coast in California, especially, it's morning. Great to see each and all this Saturday morning. On behalf of the Africa House Sacramento, specifically on the grant COVID-19 implementation task force, I welcome you to this meeting that has members from our representatives and leaders from different segments of our community in the greater Sacramento area. That is the target group of the Africa House Sacramento. My name is Ernest Owazi. I'm the project director. As you probably know, in the course of our interactions, you hear more about the work as project director in this endeavor. It is my hope that we will be able to conclude this meeting today as on time or even before time. Somebody remarked earlier whether this is going to be African time, and I said no, it's Sacramento time. Walking on from. So we'll kind of get started. Great to see each and every one of you, and really do not take this for granted, taking your Saturday morning, especially now things are opening up to be with us, to spend this time with us. It's very much I appreciate.
You want waffle?
In a way. So we'll remiss to not give a shout out at this time before we get to the opening prayer. It is a tradition within the Africa House Sacramento to start and close our meetings with prayer. It's an interfaith meeting with prayer. We try to be very mindful of the different faiths and beliefs, not to ignore or disrespect any one of those. So bear with us, in that regard. So this project really started sometime in February when we started holding different town halls. I mean, the town halls on the COVID-19, especially around the vaccines, to try to address the myth and facts about the vaccine. Before then, last year, in the midst of the COVID rage, we were also, and as we expressed concerns about Dr. Denny, do you mind muting, please? Or because you can maybe mute him later, and we can mute him afterwards. Yeah, thank you. As we are concerned in terms of the impact on people of African descent, both in the United States and also in Africa, as the belief then and continue to in some quarters that it's not a Black thing, we're unimmune, but we know better. That nobody's really immune, and in fact, the disproportionate impact on the Black community has been quite pronounced in the United States. We remain guardedly, cautiously optimistic, and remain prayerful and engaged in terms of the continent, that it has not hit the African continent as much as many of us had feared, at least in terms of lives and property. But there is no doubt that it has devastated the economy in the continent. So what we do here in this project in Sacramento, the greater Sacramento area, or in the United States, to some extent, may resonate in terms of the continent. We're all in this together. So my shout out to the different organizations and people that have been on this journey with us before this grant. when there was even no discussion about grant. The different African community organizations under the leadership of the Africa House Sacramento, and especially when we started engaging in the COVID-19 town halls, the Association of Nigerian Physicians in Americas, the Sacramento Black Nurses Association, the California Black Health Network, and the Office of the Sacramento County Public Health, especially Dr. Olivia, and the Sacramento Native American Health Center, Dr. Denny, whom you will be hearing from. I've been on this journey with us. So on this particular grant, our goal is to reach out to people of African descent in the greater Sacramento area. Later on, I will share with you a bit of the deliverables and the zip codes. Each one touch one is really what we're here about. And we believe that, yes, Africa House Sacramento can do it and maybe receive a silver or a gold medal, but with the greater community beyond the Africa House Sacramento, I think we are aiming for the diamond or a platinum medal. That's really what we hope to be able to accomplish. It's our very first grant for this emerging nonprofit organization that we hope will be able to even create the foundation for even the bigger and more prominent grant in the future. So you are in this with us, and we want to make sure that we accomplish this goal and celebrate together. And in a more serious way, something that pertains to life and livelihood, especially of our people. So in the spirit of Ubuntu, let's work together and get this done. So again, welcome, welcome, welcome. Can I get somebody to help us in opening prayer, please?
I will do.
Volunteer. An interfaith opening prayer, please. Thank you.
We gather together here today intent on doing good work. We recognize the gift in each one of us, the responsibility of stewardship of resources that may be entrusted to us for the promotion of common good. We seek to represent and serve our community fairly and well. We seek to serve with respect for all and responsibility to the future. May our souls be blessed with hope and understanding, to know that all lives contain sorrow, accepting that our lives are blessed even in loss. May our efforts be blessed with insight, guided by understanding and wisdom. May our personal faith give us strength to act honestly and well in deliberating on all matters before us. In your name we pray, amen.
Amen. Amen. Thank you, Mr. Dungo. Appreciate that. Thank you. Okay. Hello again, everyone. I hope everybody can hear me okay. Is that correct?
Yes.
Okay, thank you very much. Let me do a quick check, and then we'll get to the next agenda item, which is introduction, your name and the organization and the position in the organization. And for those that already assigned a role on this grant, you can indicate that quickly. Everybody has access to the chat. If you don't mind, can you put on the chat your zip code, just your zip code, the zip code where you live, just your zip code in the chat, please. And if you've done that, then you can do your introductions, please. Yes, Mr. Stamstack, go ahead. Introduce yourself.
Oh, I say that I was hoping to be last, but I was responding to your zip code first.
Thank you very much.
I still have morning. I apologize for being late. It was a long night yesterday. So it's good to be here. As always, when Ernest after Wazi calls, I have to respond. And it's always good to be in the diaspora. I see faces that I know. I'm excited to join in the conversation and participate in acts of change. My name is Sam Starks, as I said, and I am the founder director of MLK 365, kind of inheriting, standing on the shoulders of a long tradition of honoring Dr. King. We kind of added the aspect, and will continue to modify the march that is now 41 years old by honoring the past, impacting the future. I'm not satisfied with doing a memorial march. In fact, we've all but ended a memorial march. I think Dr. King would be happy that people would remember him and his sacrifices, but he would be even happier if in his name we did acts of change, impacting today. So we say honoring the past, impacting the future. And we will be getting those 30,000 walkers to commit to doing one act, one King act a year. And thus our name, MLK 365. And then on that walk, people could give $1, give $50, look at some of the projects that are out there, and make their commitment to those projects in volunteerism, make their commitment in donations. And so it will be a good move. That's the vision. That's the next step. We're managing COVID and trying to figure out, do we put 30,000 people in, is it time to do that walk? So that's kind of where we are. And so we're facing those dilemmas, and keep us in your thoughts.
Thank you very much, Mr. Starks, as always. I think if you all don't mind, we can go with the way I'm going, unless somebody is moved by the spirit. As always, jump in. Next, Data Baratab, go ahead.
Can you guys hear me?
Yes, you can hear you. Yes, briefly.
Oh.
Yeah. Yes, please. Introduction, your name, organization, and your role in the organization. Thank you.
I had some sound issues at the beginning. Sorry about that. Name is Data Barata. Today am representing the Center for African Peace and Conflict Resolution at Sacramento State. I am a board member there. I also belong to the local Ethiopian American community here in Sacramento. Thank you.
Thank you very much, Mr. Data. All right. Mr. J. King, please.
I'm Jay King, President and CEO of the California Black Chamber, 97.5 KDEE.
Thank you very much, Mr. King. Thank you. Mr. Julius Austin.
Good morning, everyone. My name is Julius Austin, as was just mentioned. I am honored to be a board member on Dr. Owazi's organization, AfroPeace. My 9 to 5, I am the Sacramento Promise Zone coordinator for the Sacramento Promise Zone, and the lead agency for the Promise Zone is Sacramento Housing and Redevelopment Agency. And I would love to share about what the Promise Zone is to anyone who might be interested offline.
Thank you very much, Mr. Austin. And Dr. Veronica Ofebuna, MAPAC.
Hello, good morning, everyone. Thank you, Dr. Watson, for the honor of inviting me to this amazing project. I am the chair for Nigerian American Public Affairs Committee, that's NAPAC. And in my 9 to 5, I'm adjunct faculty in the East Bay here, as well as executive director for a state-funded program in Berkeley. And I'm happy to be here.
Thank you very much, Dr. Febona. Great. Have Ms. Damaris Canton. Introduction, please.
Good morning. everyone. Thought I turned my video. Oh, wait, sorry. Technical issues. Good morning, everyone. My name is Damaris Canton. I want to say a board member in Dr. Uwazi's life and family, who's very connected, and just here to do the good work that he's always involved in.
Thank you very much.
You're welcome.
Ms. Canton. And you have a nonprofit organization, is that? Maybe we'll find out more about that later on. So I've had a couple of people to join us as observers and hopefully decide if they would like to involve and how they can involve with us. So with Ms. Canton.
Yes, you're right. Thank you, Dr. Wazi. I started a nonprofit, ION, Individual Opportunity Network. And it is designed to continue the work that I've been doing for the last 25 years in and out of schools and in communities, especially with COVID and the things that have happened. Our students we usually have 3 months of learning loss, and we're going to have, and we do have severe learning loss. And so it's designed to give parents the information and students the tools to succeed.
Thank you very much.
Thank you. You're welcome. Thank you.
Mr. Tambo.
Thank you. My name is Kwame Tambo. I'm the Vice Chair of the African House Sacramento, and currently I am the project manager for monitoring and evaluating this particular COVID project. I was a former president of the Ghanaian Association of Sacramento. Nice to be here. I welcome you all.
Thank you, Mr. Tambo. I'm sure talking about gathering data, right? You're getting the zip codes in the chat, right?
Yes, I am monitoring that seriously.
Thank you very much. Ms. Tony Tinker.
Good morning. I'm very blessed to be with everyone. I'm Ms. Tony Tinker. Today I'm representing on behalf of BAPEC statewide, and I serve as the president for all of the chapters of the state of California.
Okay.
And our mission is to talk about political issues and things that affect the Black community directly through the politics and community issues.
Thank you very much, Ms. Tinker. Dr. Salako.
Thank you, Ernest.
Good morning.
Yeah, good morning. Good morning, everybody. I'm Babatunde Salako, a primary care physician with Kaiser Permanente. I'm here in capacity as the chairperson, Association of Nigerian Physicians in the Americas. And been collaborating with Sacramento House for quite some time. I'm glad to be here. Thank you.
Thank you very much. Thank you very much. Mr. Carl Pinkston.
Good morning, everyone. My name is Carl Pinkston. I'm director of the African Research Institute that does a lot of work with the Africans in the diaspora, most particularly as it relates to issues in education, working alongside of another organization of the Black Parallel School Board. Thank you.
Thank you very much, Mr. Pinkston. That's Jonathan Kalibala. We can hear you. Sorry, I don't know if it's the audio. Okay, you want to try it again? We can hear you still. Okay, do you want to use the chat and maybe we'll come back to you? Mr. David Kamara, Mr. Kalibala, we'll come back to you. You want to try the chat, we'll come back to you. Mr. Kamara, David Kamara.
Yes, good morning. My name is David. My name is David Kamara. I am the president of the Sierra Leone Humanitarian Project in Sacramento. It's humanitarian project.
Yeah. Okay. Thank you, Mr. President of the Sierra Leone Humanitarian Project. Dr. Dan Taylor. Dr. Dan Taylor?
Okay, here I am.
Thank you.
Good morning. I'm Don Taylor. I'm a professor of communication studies at Sacramento State. I'm a member of the board of the Center for African Peace and Conflict Resolution. And I am the former chairman of the board of the National Organization for Sierra Leoneans in North America. On this task force, I've been asked to serve as a communication specialist. Thank you.
Thank you very much, Dr. Taylor, and especially cultural communications specialist. Dr. Adeneye. Dr. Adeneye, please, yes. Then afterwards will be Ms. Obong Enyang, and then Dr. Ati Mosupir. You're on mute, Dr. Adeneye, you're on mute. Sorry.
Can you hear me now?
Yeah, we can, yes.
That's interesting. It's showing up as on mute now. But I'm Hakeem Adeneye Jr. I'm a family physician. I'm the medical director at Sacramento Native American Health Center. I also serve as the chair for the California Primary Care Association, supporting Black communities working group, and for this task force.
Thank you very much, Dr. Adeneye.
Too tight.
Ms. Ubong Enyang.
My name is Ubong Enyang. I'm just here to help out as much as I can.
Thank you very much, Dr. Ms. Enyang. Dr. Ati Mosupir.
Dr. Ati Mosupir, work at Sac State as an associate dean, and I am from South Africa, and I'm also on the planning committee for the next 30th anniversary for African peace and conflict resolution. Thank you.
Thank you very much, Ati. Mr. Sylvester Wadele. Sylvester, are you there? Okay. We'll keep going on. Ms. Evelyn Nasuna.
I think Sylvester was on mute.
Yeah, I'm back on.
Go ahead, please.
Yeah, good morning, everyone. My name is Sylvester Owadiali, and I'm currently serving under Dr. Owazie, African Peace and Conflict Resolution. I was one of the original members. I was away, but I'm back in full force, and I'm glad to be here.
Thank you very much. You're back in full force, and you're now on task force.
Yes.
Ms. Nasuna.
Yeah. Good morning, everyone. My name is Evelyn Nasuna. I am from Uganda, and I serve on the board of directors for the Africa House as the secretary. Thank you.
Thank you very much. Mr. Dungo?
Good morning, everyone. My name is Edwin Dungu. I am the Chief Operations Manager for Africa House and this particular project. And then in the community work, I've been serving as the president of the Interfaith Council of Greater Sacramento for the last 10 years, just retired this year. Then I'm the moderator for committee and representation for North Central California Presbytery. And also in my regular work for the Sacramento County Office of Education Support Services.
Thank you very much, Mr. Dungo. I think we have, okay, Ms. Cecilia, Africa House. Go ahead, please.
Good morning, everyone. My name is Cecilia Ngozi Ojingwa. I am a teacher, a science teacher with Elgro Unified School District. I am a minister of El Shaddai World Evangelism Ministries, and I serve on Africa House Sacramento as the administrative manager and coordinator. Again, it's wonderful to see all of you. You're welcome.
Thank you very much, Mr. Jungwa. Is that Mr. Jonathan Kalibala? Are you able to communicate now? Okay. That's Lillian's iPhone. I think that's Dr. Duru. You want to introduce yourself and put your zip code in the chat as well. Okay, Jonathan, go ahead, please.
Yeah, sorry about that.
I think you're getting echo because you have two systems on. So maybe short one.
Yeah, can you?
We can hear you, but there's an echo.
Yeah, let me first. Let me log out of the
remove the audio in one. You have audio in both.
Go ahead. You're okay now. Go ahead, please.
Yeah, I think there's an issue with my PC, so I just shut that down. Sorry about that. My name is Jonathan Kalibala. I'm with the Sacramento community classification. I'm a software engineer working for a company called HashiCorp. We do cloud software, and I'm willing to and here to participate and collaborate and contribute to the Africa House. So thank you for having me.
Thank you very much. You're very welcome. Thank you. This is Lilia iPhone. I think that's Dr. Duru. You want to put your zip code and on the chat, and then introduce yourself, please. Dr. Duru. Okay.
Unmute yourself. We can hear you, Dr. Duru.
Okay, Dr. Kindarara, I don't know if we've got to you, please. Did you put your zip code? I hope we didn't miss you.
Oh, okay. Yeah, I tried. Let me see. Good
Okay.
morning. First,
Good morning, please. Yeah.
Good morning, and thank you for the invitation. My name is Dr. Kindarara. I'm a faculty at the Sacramento State School of Nursing, and also in the community. I work at the VA Medical Center, managing or directing the patient care, especially when I have a COVID a wing where I'm managing right now with the COVID wing at the VA Medical Center since last year. So it's been a year and a half managing that COVID wing, and I'm really honored and humbled to be invited to join the effort of the Africa House Sacramento in working collaboratively with the rest of the community, how we can tackle the hesitancy and the barrier to COVID vaccination in our Black community in the greater Sacramento area. And thank you.
Thank you very much, Dr. Kendara. Did you say we got your zip code or not? If you don't, we can put it in the chat.
Not yet. Yeah,
okay.
I'm gonna go ahead.
Okay, thank you very much.
You're welcome.
Thank you. We have Father Franklin Moore joining us. We're introducing, doing introductions yourself, your organization, and then if you don't mind, put your zip code in the chat button. That'd be great. Reverend Moore, please.
All right. All right. Good morning, everybody.
Good morning.
My name is Franklin Moore. I live in Sacramento here. I've been part of this meeting and always with Professor Wazier whenever he calls us. So I'm sorry I came in late. I joined the retreat since 7 a.m. and we're still going on now. So I just have to be here because of the importance of this meeting. Thank you so much.
Thank you very much. Reverend Moore, do you want to talk about your organization? You are our representative from the faith community.
Yes, the church we belong to is the Anglican Church under the Anglican Church in North America and the Diocese of Trinity. The church is also part of the community here. and whatever that is necessary to do to sensitize our people, to talk to our people, to reach out to our people in the society. We are always on hand to do that, most especially reaching out to our people, preaching the word of God to them, sensitizing them on things that are necessary, giving them necessary counseling. And then on this very one, which we're about to get into now, piloted by Professor Wazier, that has to do with sensitizing our people on the issue of vaccination. We're also part of it. And we're also doing our best to reach out to the people through the church in the community.
Thank you very much. Appreciate that. Thank you. Did we miss anybody in terms of the introductions? Please speak up now. And Reverend Moore, if you don't mind, in the chat, put your zip code, most appreciated.
Okay.
Okay, so I think we got everybody, I believe. As you can see, this is very diverse. I anticipate and I invite that if you think there is any critical segment of our community, African American, Caribbean communities, we are one, but we speak in many times in different tongues and accents and phonetics and linguistics, but we're still one, as the spirit of Ubuntu. Please let me know if you think there is another segment of our community that we can bring to include. There were several people who, for one reason or the other, couldn't attend, including a couple of other people from the faith communities. We invited about 4 different segments of the faith-based organizations. 2 of them said they will be here, but Reverend Moore has responded maybe before the end of the meeting. Maybe we'll hear from Reverend or Pastor Karif Lawrence of the Antioch Progressive Church. There has been some suggestion to reach out to the Baba Union or Association, Baba's Association as a critical segment. So please, you've heard from everyone and the other respective organizations. In the spirit of Ubuntu and representation of our diverse communities and populations, do reach out, let me know directly any other contact organization that you think or community you think we can bring to join us in this effort. Hopefully, Miss Janice Wisdom from the Jamaican Caribbean Association of Sacramento, I know she did indicate that she'll be joining us because she has been part of the planning of this grant and this meeting all along. So we hear that. Okay. All right. I hope everyone is doing okay. And thank you for the introductions and response to the question on the zip code. Before I get to the next segment quickly, using the reactions button, how many of you know somebody that is either reluctant or about or opposed to the COVID-19 vaccine? It could be a friend, a family member, or a colleague. Just use the reactions button and indicate, please. We hear you, Mr. King. Probably more than one, right? Okay. Yeah, the reactions button. If you want to type in the chat, yes, that would be fine as well. If you prefer it that way. Okay. Mr. Dungo, I mean, Mr. Tambo, you're with us, right? Thank you very much. So in the chat, I pasted the what this grant is intended to accomplish. Again, there is a need for vaccine outreach, particularly in the Black community, the community of the African diaspora. In the Sacramento County, the record indicates the vaccination about 50%, which is below the statewide of almost 70%. And this was a presentation a couple of weeks ago that was organized by the Sacramento NAACP, where you had the mayor of Sacramento and the president of NAACP and a physician and several other speakers emphasized the importance of targeted, serious, compassionately forceful effort within the Black community in the Sacramento area, where make up about 12–13% of the population, but twice that number of the population of the unvaccinated. I attended a wedding last weekend, and with Dr. Tell and Ms. Ojingwa probably know what I'm talking about. At the church service, it was predominantly Nigerian American wedding. One of the Catholic churches in the area. The mask, the sign going in would say masks required. But in this church of about 100 people during the wedding's church service, I estimate only maybe a third of the people were wearing masks. And so you can imagine my anxiety going to the reception later on that evening in a hall of nearly, I would estimate, 400 people. The same representation, most of the people were not wearing masks. So you can compare that with the CDC requirements, in a way. So you can extrapolate that in terms of our people, the seriousness of the matter, as really a matter of life and livelihood. So this is what this effort is about. How can we as a community really in the spirit of Ubuntu, I am because you are, therefore we are. It's not saying you don't have your individual right, but really your right is as important as mine. And to the extent that we can approach this as a community effort, engagement, necessity, we'll be able to make some progress, in this regard. So this project, with regard to definitely the outreach for the vaccine, get people who need assistance, if it means appointments, registration, or even transportation, to identify vaccine sites near where they are and help them to do that is one. To continuously educate and educate and educate, to create awareness, address, we recognize the significant and legitimate concerns and questions people may have for being reluctant or opposed. To do that in a way that acknowledges those concerns, but be able to respond to them with the facts and fight against the misinformation and the myths, both about the COVID and vaccine. Everyone in my family is vaccinated from the beginning. How can we ensure and promote this awareness across the board? So the outreach is, in terms of education, creating awareness would mean direct contacts, as the case may be, going to events and spreading the word. We are not going to be forcing anyone. All we can do is use the power of persuasion and education and awareness. Hopefully people will make the right decision. You will hear shortly from Dr. Don Taylor in terms of developing the campaign message that will be a first call to the community to participate in this endeavor of what will be the campaign message that will really get to people that we can rally around and use that as the focal point for our outreach, for the education, for the support in order to increase the rate of vaccination, especially in the target population and zip codes. We're not leaving anybody out at all, but we're very mindful of the target population and groups of people of African descent for which this project is targeting. So the key in the chat, we kind of posted the deliverables, which we will track and report the number of individuals that we have reached through this effort, the number of languages used to create the vaccine outreach materials. So I anticipate, for example, when we develop the thematic slogan, we may probably produce that in more than the English language. We will make that determination later on that will speak to our people, population. The number of languages used to speak with individuals during the vaccine outreach. So as we talk to our friends and family members and colleagues, we speak them in the language that we probably know that they would understand and hear. It may be more than one, maybe it's said in English and maybe in Igbo or Yoruba or Swahili or French or whatever that language will be, be able to, indicate that. How many people did we support in terms of the vaccine providers, including the mobile clinics? Did we support or engage in this endeavor? And Dr. Duru may speak to that during his own presentation. The number of people who got vaccinated from the outreach support, and especially for our own internal consumption. The target zip codes are there, but really subject to change. We're kind of flexible. The key thing is within the greater Sacramento area, up to San Joaquin, meaning Stockton is San Joaquin, and up to Yolo, Davis, up to Davis for Yolo County. The plaza, of course, the Sacramento County will be what we mean by the greater Sacramento area. It does not mean that if we're able to reach somebody beyond these areas or communities that we're not able to, but our target will be within the greater Sacramento area and these, zip codes. So our hope and expectation and call and invitation for those of you that have reached out and you came because of my association or our relationship and many other things over a period of time, or because of the call for this important endeavor, truly appreciate that. What we're really calling is to join Africa House as a friend, as a partner, as a member concerned in the community to deliver on these key objectives of the grant, especially as it pertains to people of African descent, of the African diaspora in the greater Sacramento area. So I'm going to stop there for now, see if anybody has any questions I can address quickly, and then we can get to the next agenda item. Any questions so far?
I was just wondering.
Please.
Did you get a chance to call the Liberian leader, Luveta? I'm surprised she's not, because she will be key in helping us connect with the Liberian community in Sacramento.
Yeah, not her specific, but I did reach out to the president of the Liberian Association. I think he joined, Mr. Mongru. He's on. Yeah, please.
Oh, okay.
Mr. Mongru, go ahead. You want to speak? Yeah, please.
Thank you.
You can go ahead. Mr. Mongru, you can put your zip code in the chat if you don't mind, and then introduce yourself, please.
Definitely, I will do. Hi, everyone. My name is Amos Mongru. I do apologize for being a couple of minutes late, a little past out, but I'm glad to be on. And once again, thank you for the invitation, Dr. Wazi. And as you said earlier on, we wholeheartedly work on the idea that we can work together progressively to make this come to fruition, especially letting our folks know the importance of this vaccination as well. So as you said, I'm definitely going to go to the chat room and post that, as you said. So once again, I'm glad to be on board and look forward to this discussion.
Thank you very much. You're welcome. Yeah, we did, we did invite the leaders of the, the Nigerian Association, the Ethiopian Association, the Ghanaian Association. Several of them did say, yes, they would attend all, say, conflict, and we'll see if somebody may stand in their place. We definitely will follow up later on, even if it means going to them in terms of their meetings and events to engage them. I know everybody's kind of busy, so thank you. Any other questions or comments? Otherwise, we'll go to the organogram by Ms. Nasuna. Any other questions I need to address so far? Okay. Okay. Yes, Dr. Denny said, he still has some patients and friends. Yeah, and yeah, we heard some of those horror stories of, oh, I wish I listened. I wish I got the vaccine. Dr. Taylor was sharing with me over the last weekend a horrible story, a very sad story of a young African, Liberian, I believe, or Sierra Leonean, who passed away at 40 years doing her doctorate program. Didn't get the vaccine, got sick shortly after returning from Florida. Dr. Taylor, you want to start? I don't want to tell your story.
Well, it's not my story. It is what happened.
Oh, yeah. You told me, so you are here. I don't want you can finish it.
Yeah, and the president of the Sierra Leone community, David Kamara, can also chime in if he feels
okay.
Blind. But yes, we got sad news that a young lady who, by profession, I believe, is a social services worker of some sort. She holds a bachelor's, master's degree. She was working on a doctorate. Actually, she just got an assignment to go overseas to lead a project which she should have been doing next week. She went to a meeting in Florida, currently the hotbed of the Delta variant. She had not taken the vaccine. She was not persuaded by its efficacy or its use, or for whatever reason, she was not persuaded by it, so she didn't take it. She came back feeling signs of pneumonia. And as far as I know, didn't get any treatment for it, just felt it was like a cold. She called her aunt, and her aunt said, "You've just come from Florida, you're feeling sick. Have you still taken the vaccine?" And she said, "Well, let's see what happens. Maybe when I get better, when I don't have a cold anymore." Nobody heard from her for 3 days, so her cousin went to her apartment and found her dead on the floor. She died of COVID-19, and she has been buried back on the East Coast where her parents live. So that's it. She died. She didn't want to take the vaccine. A very highly educated person, a professional of strong standing, and yet something stood in the way of her need to be vaccinated and to save members of her family. In fact, her cousin who discovered the body thought she had fainted and went to do mouth-to-mouth resuscitation on a dead person who had been lying down dead for 2 days. He didn't know until he actually realized that there was no response. The body was pretty cold. And that's when he discovered that she's dead. And that has put that young man in danger, but he has informed us all that he was fully vaccinated and he's still doing fine. David, did I miss anything?
Dr. Taylor, you're perfectly right. And I just want to add something regarding the community that I live here, that we all live. And we have a family that got infected. And as I speak to you, the guy is partially paralyzed, and we're still praying for God to intervene. So there is a lot of sensitization that we need to do in our community. We have a lot of healthcare workers that are still refusing to take the vaccine. And I think this is a step in the right direction. And I look forward to working with you guys so that we can disseminate the information to the community. This is a good thing.
Thank you very much, Dr. Taylor and President Kamara. Appreciate that. And you can go on and on. I think in our personal lives, in our families, and in our communities, such very sad stories of death and sickness or infection and devastation of one form or the other. So it's important. So feel free in the chat if there are other, and I know I see some comments in the chat, so please continue to share that that you'd like to share with us. That'd be great. Quickly, Ms. Nasuna, this is draft is still work in progress, please. But can I give you kind of an overview of the organogram, kind of the structure we're kind of working from? Of course, the Africa House Sacramento Board of Directors is really the umbrella, kind of oversight. This is within that, under that is this task force itself. We try to separate, of course, the regular work of the board from the project itself for both practical and professional ethical reasons. Okay, Ms. Nasuna, please.
Thank you, Dr. Owazie. Good morning, everyone, again. I hope everybody can see my screen.
Yes.
Yes.
Okay, great. So this is what we envision the project implementation structure will look like, and would like your feedback. So yeah, very quickly, we see at the top we'll have the project director. Actually, at the end, maybe Dr. Owazie, you would share maybe which positions are filled and where we're still identifying technical people to fill the positions that have not yet been filled. So below the the project director will have a number of technical staff reporting directly to him, including the chief program manager who will be in charge of payments and business relations. We'll have the program manager in charge of community outreach and events. We'll also have a coordinator for field services, a program administrative assistant. We'll also have the program manager in charge of monitoring, evaluation, accountability, and learning. Then we also have the assistant program manager in charge of planning and monitoring and evaluation. And lastly, we'll have the coordinator in charge of media, communication, and technology. So under each of these program managers, we'll have people that report directly to them. And for the chief program manager, we'll have the legal specialist and tax specialist or bookkeeper reporting directly to him. For program manager in charge of community outreach and events, we'll have the community and, our expert partners, for representing the different communities. We have and then we have the coordinator, field services, and below him or her, we're going to have the behavioral and mental public health specialist. We'll have the medical specialist, who will also be in charge of the guest speakers. Then we also have the community health educators. All these people will, all these technical people will be, reporting to the field services coordinator. Then below the program manager monitoring and evaluation, we'll have the assistant M&E manager. And then, no, I think we don't have the administrative assistant there. We'll have the admin reporting to the project director. And then the coordinator, media, communication and technology will have the cultural communication specialist reporting directly to him. So very quickly, this is our envisioned, project implementation structure for this project.
Thank you, Ms. Nasuna. And again, this is a draft, still kind of work in progress. Can I share with you our current thinking? Some of the names may be tweaked or even change, or even collapse, as we definitely want to be as inclusive as our diverse communities, but also efficient and effective, in the process. So any quick questions or comments or suggestions, please speak. Let us know. Okay. Okay. Maybe you can think about that. And if you please in the chat, feel free to raise a question about the organogram, and Evelyn, if you can respond to that, or any suggestions that you may have about the organogram, please, you can share that in the chat, please. Thank you very much. We have a couple of key decisions to make, and Mr. Dungu is going to lead us in the next one after the message. Dr. Taylor. One of the things that we really is critical, the first thing really would like to go get is develop out of this project or this endeavor of education and campaign. Is a campaign message. What is it going to be the slogan? Something that is short, and I think we said 3 to 4 sentences that really captures it. Ubuntu for life and health is what comes to mind. For me, something that our people will resonate with our people, that we may be able to produce in other languages, as short and simple, but also does capture the message. So our cultural communications specialist, Dr. Taylor, will guide us in the next 5 minutes or so on this particular endeavor. Dr. Taylor.
Okay, am I?
Please, yes, Dr. Taylor, please, you're on. Yeah.
All right. Well, thank you very much, Dr. Owazie. So let me say that, as Ernest has just explained, he asked me to assist the task force in a process to help develop an effective, respectful slogan that would accompany all the messages, all the outreach efforts that would be the thematic slogan that is part of this campaign to promote COVID-19 vaccinations in the greater Sacramento area and its immediate environs within the African diaspora community in the area. And so after several discussions, we kind of jointly agreed that a good way to go about this would be to begin to involve the community we're trying to reach. We are trying to reach a community, and the community we're trying to reach should be part of developing the message. And so that's what led to this particular initiative. And so I don't know if Angie, if you have it up there, I don't want to read it. Hello, I didn't know I'm meeting right now. Okay. Yeah, okay. Thank you, Angie. Let me go through it real quick. I think it'll give you the flavor of what it is. We will be issuing a call to the community, organizations, individuals, anyone who is going to be able to receive this call, that it says the Africa House Sacramento is launching a campaign to promote COVID-19 vaccinations in the area. And the specific content of the call describes that African community, faith-based individuals of African descent are asked to submit a maximum of 3 thematic slogans and statements that are culturally appealing and relevant to be used by this group in its campaign to persuade, to educate, to make aware, to bring about direct appeal, and so forth, as Ernest eloquently outlined earlier this morning. And so the goal is to overcome the misinformation, the myths, the fears, the hesitancy, and promote an opportunity for more people to take the vaccine and also to heed the health precautions and try to overcome any inherent fears of the unvaccinated. We let those who receive this information know that the project is sponsored by the Government Operations Agency of the State of California through its Public Health Institute. Now, so we see
Did we lose Dr. Taylor? Okay. Maybe Ngozi, maybe you can go ahead and project that, because we can read that through that together quick, slowly while we wait for him. He can join wherever he finds us. Go ahead. Ngozi, can you scroll down the screen? You're on mute. Okay, I think the call is to use a form. We may need to adjust the deadline, but we want to bring this to your attention. The goal is to select the top 3 and provide some cash prizes in the form of gift cards or gift certificates to the top 3. The third place will be $100, the second place will be $150, and the first place will be $200. And you, this group, will be responsible, will be making that decision in terms of what the selection would be. As I mentioned before, simple, memorable, creative, bold, that shares the vision and the goal of the campaign for uptake of vaccination, that is believable and credible. Again, a lot of discussions about being culturally relevant and effective. That is short, clear, and concise, possibly not more than 3 to 4 words. Before I said, Ubuntu for life.
I'm back.
Ubuntu for life and health.
I'm back.
Dr. Tell you back. Okay.
I'm so sorry. I am not speaking from Sierra Leone, where the power would normally go off. This is just from Sacramento here in my house. And apparently the cord, the power cord to my wall just pulled out. So I really apologize. But have you?
Yeah, on the screen. Welcome back, Dr. Taylor. On the screen is where I'm talking about the short, clear, and concise, possibly not more than 3 to 4 words in terms of the messaging.
Right.
Yeah.
So you're going through the key points that the slogan would entail.
Exactly. Yeah.
Well, thank you very much. And again, I apologize that
it's okay.
I lost power. Okay. So culturally relevant. One of the things that I am very concerned about, as somebody who has been very much involved in intercultural communication is the need for respect. Sometimes we think that our own view is best. We are more respectful in our own way than others. And so I would hope that this implementation committee, in evaluating the submissions, will look to the extent to which those submissions will minimize disrespect and maximize cultural relevance and appropriateness as Africans. Also, it's important that the message is understood by the target group. Now, my thinking at this point is that the target group would largely be the unvaccinated and the ones who go to weddings without masks, as Ernest found out last week at that wedding where we were all present. But we really want to reach out to people for whom this grant is designed to capture. And so let's keep that as part of our evaluation matrix, that it is targeting a specific group and that group can understand the message. Create.
Dr. Tolo, did we lose you again?
Say that again.
Oh, okay. So you were okay. Do you want to go straight to,
well,
down to the final? We've got a couple.
Yeah. Let's move it on because I think you can share this document with everybody, right?
Yes. Yeah. Mm-hmm.
Okay, and then we have a submission form, and we try to make this form as simple as possible, but also to be a way to capture some minimum data. I do think this particular form can benefit from some additional input today or through the chat, because basically what we're asking for here, obviously, is the name of the organization or individual. So if Amos Mongru, president of the Liberian Organization of Sacramento, is submitting one, he would say ACFLI, the Liberian Organization of Sacramento, and his name and the address, the email address that would come to it, and phone contact. And we would give him or his organization 3 opportunities to come up with a slogan. Now, you have said 3 to 4 words. I don't know if the committee is going to be strict on that. If they're going to, if somebody submits 5 and it's catchy and great, would it be disqualified? So you all have to make those decisions. And also why they think it's of value. Now, in terms of data gathering, we wanted to get a sense of how many people participated in that draft of that slogan. Is it 1 person? Is it 10 people? Is it 100 people? To give a sense so that whoever is working on data can factor that in at some point. The other data point that we thought this form could generate is, you know, of the people who participated, how many have taken the vaccine, and we didn't put 0, but less than 50% was one band that we thought would indicate it's not going too well in that community, not taking the vaccine at all, or that they plan to take the vaccine. There may be some of the questions you may want to add to this submission form. So, you know, I don't know where Ernest wants to go with that, because I think he wants the form and the letter to go out probably tomorrow or sometime very soon. So that's it, and I'm open to questions.
Thank you, Dr. Taylor. The last questions, I kind of modified it. There was a version, a slightly revised version of the last questions that I sent you last night, a kind of revised version. I'm not sure if you've seen that, but it's in the chat in terms of the question. There was a feedback that we got from some members in the draft about maybe revising the question slightly to ask about, instead of percentages, how many have taken the vaccine, not taken the vaccine, plan to take the vaccine, and then finally, have you been affected by the COVID?
Very good.
Yourself, family, or family members. So
I haven't seen it, but that's good.
Okay. Yeah. Thank you.
That's good. But I think if you're going to have input, because it says input here, it would be good for us to hear if this form, of course, its primary goal is to help this committee select a slogan. But as part of that, it is useful to know who helped develop it and how they are connected with people who have or have not taken it and so forth. If you think there's something we can capture without inundating the form, I think this is the place to say it.
Yeah. Thank you, Dr. Taylor. That's great. Any questions, comments, observations, please? I did put those in the chat.
I see that. Yeah, very good.
Hello.
Yes.
I just want to know if the slogan gonna be for a specific community or a specific dialect or a generic one, English, or something that will go with the community, or it's a generic one. So which type of slogan do you guys need? Do you guys want us to do?
Well, Dr. Uwazi already indicated that this is going to be a general slogan that will accompany all outreach campaign material that will go to our communities. But it will be helpful if that slogan is translatable to different language groups, so that anyone receiving it, whether they're speaking English, French, whether they're speaking Igbo, Swahili, Xhosa, you know, if not everything is effectively translatable in languages we know, but those that can be, he would obviously see if we can work with that. But it would be a generalized campaign slogan in the spirit of Ubuntu to promote vaccine awareness and vaccine uptake in our community.
Okay, thank you, sir.
Any other questions or comments, observations?
When I was gone, Ernest, did you go over the deadline, the dates for submission? And
Yeah, yeah. I said we may tweak it. We can work on that later. Yes.
Yeah. I think that I would like to do what you did before with the reactions button to see how many people here, if you don't mind, Mr. Chairman, indicate either a thumbs up that it's good to go, or I don't know what all the reaction buttons are, but if somebody has some questions or concern, that would be helpful too.
Yeah. Yes, please respond.
So it's not necessarily a question. Can you hear me?
Please, yes.
Yeah, so it's not a question or a concern, but I know you had mentioned looking at the target audience, and I apologize, you're going to hear my kids in the background. In terms of thinking about who we can, obviously we want to target those that are unvaccinated, but I think it might be really helpful to really look at those that were hesitant and more recently got the vaccine and what may have caused them to make that decision. Because those that have been unvaccinated, I think there's still a lot of value in finding out from them what is causing them not to be unvaccinated. But I think there's a decent amount of information that we might already have in that regard. But for those that more recently made that decision to get the vaccine, what was the determining factor for them? So that we can
would you like to, Dr. Adeni, would you like to include that question on the form? Because
I think that
it would give us additional information. You know, Ernest has just posted some of the revised questions, and perhaps one of those questions could be the one Dr. Adeni just identified. What if you have received the vaccine? If members in your community have received the vaccine, what largely helped them to do that? Now, remember, this is a summative form, unless it's coming from an individual, it's coming from organizations. So yeah, I don't see a problem with that question. It helps. I understand that there's somebody on this committee who is the data guy. So that person will be able to provide the analysis. Thank you, Dr. Adeni.
Dr. Taylor, I think, and Dr. Uwazi, I think what we can also consider is our audiences. So, you know, we're looking at questions, but we may to the last Dr. Adeni's point of people who have.
I've lost you.
You guys hear me?
No,
yes.
Go ahead. Yeah.
You hear me? So
yes.
I like the idea of questions, but I also like the idea of us identifying groups or audiences. So there's people who have recently made the decision to get vaccinated, and if we can see them as a group or an audience, so in addition to questions, I think it's helpful to identify these segments of people. Maybe someone who has that is reluctant is one group. People who have not taken it is one group. But there's that group that he just identified, which to me is people that have recently taken it and why they have taken it. And I would almost see them as a group set apart to kind of analyze a little bit. Was it because of the job, right? United Airlines recently said, you will take the test if you want to work for us. And I'm wondering just, if we could segment these, create groups or segments, and as opposed to just, sets of questions. And it may be kind of premature in this whole process, but I just wanted to deposit, and I wanted to really kind of add on to what Hakeem was talking about, but in a real sense of maybe us looking at segments or groups in addition to questions. So Dr. Taylor, I know that you probably have a way of factoring this in. I just throw this, I deposit this, and you could do what you want to with it.
Well, actually, Sam, by the way, it's good to see you again after a while. That's one of the great things of
nice to see you as well.
When Ernest put this group together, some of us get to see each other again. Yes, indeed. In fact, I thought that what Dr. Adeni was saying goes exactly to what you've just said. And that's why I maybe I joked about it, but I also said that there's a data cruncher here who's going to be able to put these different responses into groups that would then help expand upon the question that David Kamara asked, who are the target groups and who are the target audiences and so forth. And Dr. Adeni helped us try to identify something to put on a form that then the data cruncher would be able to segment into different audience groups. So yes, Sam, I think this is clearly important stuff that has now come from 3 people on this panel. So I really think we can't ignore it.
Very good.
Yeah.
Thank you very much, Dr. Taylor and Mr. Sam Starks. Mr. Wadele, you have a question? Is that a hand up or question or comment? You are mute.
Yeah, regards to the slogan, I think it's a positive sign, but I want to say that maybe whatever slogan you speak, maybe we should put it in English and disseminate it to different leaders or groups, that way they can translate it in the various languages, just a thought of mine, see if we can do that.
Okay.
So Ernest, before you move to the next agenda item, because I lost power to my laptop for a minute, I don't know if you talked about the competition and cash prizes.
Yes, I did. Yeah.
Okay.
But we can, if people have any reactions to that, they can maybe we can try and wrap up in a minute or so. That'd be great.
Well, what I wanted to know from the group, because we took numbers out of the hat, if you like, I just wanted to know if this collective group believes that the cash prizes in terms of amounts, whether they matter or not, in terms of whether it's $50 or $100 or what. I mean, are people going to do this for the moral value of what they're doing, or are they going to be doing this to win some money for their organizations? et cetera, et cetera. I just wanted to put that out there so that it's not a Don Taylor and Ernest Uwazi decision that this is the price range. I just like to get some real quick thoughts, and like you said, 1 minute.
Afli.
This is Amos here. I wanted to piggyback on the previous speakers, but I would just be very fast because it's just
I would urge you to hold up on that, Amos. I'd like to get a sense of where, because this is going in the letter. Would anyone have anything to say about the extent and quantity and quality of the prize that you will hand out to the winning slogans?
I can speak to that effect.
Right.
I think it's a catchy one, wherein there's a monetary value add to that, because that will put more importance to it for many folks who want to participate into that. I think that is wise. The only thing is that I do not want us to primarily count on that, because folks at times may receive the money per year, may not put more interest, but communicating the message is what I really wanted to communicate on, because I believe one of the key aspects that are holding a lot of people, especially a certain demographic of folks, is the message that have been portrayed out there by the media, by individuals, and different forms of people. Like take for instance of recent, a lot of folks within my community have been vaccinating themselves, right? But lately there was news that went out stating that even though you may be vaccinated, but despite your vaccination, there's a likely cost. You may still get contact with the recent virus that is about to unfold or that is unfolding. You understand that? So the communication that is spreading out there, a lot of mixed information, and there is disseminating to different forms of channel medias and other places that people are not getting the right sources. Many of us over here may do our research, may go to CDC and no other thing to do our vaccination. But those within our community, they are not inclined to that extent to get this information as we do our research. So I think that is one of the key factors we should contemplate on. What are the message that we will come up with as a group and a team that will strategically target a particular demographic of people, especially wherein we're trying to target. That was one of my key points I wanted to stress. But I think the monetary value is good, but we also should look at the message that we're trying to portray. That's
so in effect, what you're saying is that what is there now, the monetary value is fair, because it is not looking for a lot of money so that people get a lot of money and then they don't have the interest. Just a token of their participation. Okay, fine. That's what I wanted to know. Thank you.
Okay, thank you very much, Mr. Mongro. Mr. Tambo.
Yeah, a quick one. I agree with Mr. Mongro. The message probably is more important, but the monetary is just an incentive. But Dr. Taylor, I think we should leave the money there, and as well as the message. But the message comes first before the money. But the comment I want to make is actually to maybe Dr. Mwazie or even Dr. Taylor. We want to clarify that what we're doing today is like back home where the gong beater will beat the gong and announce that the chief wants you at the so and so, or I want something to say. That is what we're doing today. There are more to come. So this is just to let the door open so we go out and tell people that this is our intent. So there's going to be we're going to do presentations. There's a lot of activities behind what we're planning to do. And we have all the way to February or January next year. So this is just the beginning. So we will need your help. We need your ideas, but this is just not all in all. This is just the beginning. So
thank you very much, Mr. Tambo. I wouldn't add to it. Yes, you said it well as always. Okay. Dr. Tully, any concluding thoughts? Then we can move on to the next agenda item.
I think I am reasonably satisfied that with the amendment that you have submitted to the questions and the comments that have been made by panelists here regarding target groups and audience segments will be taken account in the analysis of the data that we receive. And then I think it sounds to me like we're ready to go forward to launch this first step in the campaign as President Kwame Tambo. Well, since you're no longer president of the Ghanaian Association, should I say former president, Kwame Tambo has suggested. So let's move forward. We'll collect the data, we'll send it out. I don't know if everyone in this group is going to be someone who receives this communication to disseminate it in their different communities. I don't know.
Yes.
What the process is going to be to get the word out there.
Yes. Yes, everybody here would be sent the information and beyond. We have a data base and we are building on it and will be disseminated. And please, when you get it, we also rely on you to help get it out and send reminders and use any public forums, events, meetings that you may have in your discussions to drum up support and respond. The goal is to have it.
In addition to that, Ernest, in addition to that, I don't want them to wait until their next public function. I think everybody here should make a proactive, positive effort right after this meeting to reach out to the community, to report back on what was accomplished here today, and to let them know that there's a letter coming and that they want to engage them and energize them and participate, as President Amos Mongu said, with keen interest in the objectives. So that's all I would add.
Thank you. Makes a lot of sense. Actually, begin to kind of whet the appetite.
Yes.
There is a comment from Dr. Veronica Ofebuna. Did you discuss your choice with your doctor yet?
All right, I meant COVID-19.
Yeah, I know. Yeah, I thought as much. Yeah. Thank you. As again, indicated, this is just the beginning. Later on, you will hear from our medical specialist, Dr. Adeni, in terms of the plan for a series of town halls, whether it's going to be weekly or bi-weekly or monthly or a combination. In addition to maybe some listening sessions, focus groups that would happen, as well as other direct kinds of contacts until this project goes through February. Our goal is to try to wrap up most of the activities by the end of the year, January latest, so we can use February to wrap up and engage any contingencies. So thank you very much. Any more thoughts or questions or comments, please feel free regarding the call for community input on the campaign message slogan. You can post in the chat, and Dr. Taylor will be observing, taking that as well. I know a couple of representatives from the Kenyan Association of Community joined us earlier, Dr. Bena Ara and Mr. Alex. You're welcome. And there is a young lady who is really eager to do work in the community, especially as it pertains to the young folks. Ms. Kelechi Okebo, you are welcome. If you don't mind in the chat posting your zip codes, the zip codes of where you live, I would appreciate it. And when you feel like saying something or weighing in, please do so. In about 5 minutes or so, Mr. Dungo, do you want to go over the gift certificates idea? The current plan or suggestion or thinking is to budget a certain amount of money, let's say $5,000 to start, as a start. In gift certificates, how much of that will be in 25 or 30 or up to $50? Who would get it? Is it people that come to events and maybe figure out a way to arrange it in a way that will be given out, or do a draw, or ask some questions that is something interactive and educational as part of it? Or if you get the jab, right? Either the first one or the second one. So the goal, the thinking currently is about $5,000 initially. We can come back and review if we want to come down or move up a little bit on that. Gift certificates targeting Black-owned businesses in the greater Sacramento area. Should it be 100% Black-owned businesses? Should it be 90% or 80% or 50%? We have not made that decision. So we're hoping that this body will participate in this very critical decision, just like in the call for community input on the message for the campaign. So, Mr. Dungu, you want to pick it up from there?
Yes, I would like to share some specific areas where I think we need to do based on the timelines. Let me share the screen.
Mr. Dungu, that's taking some time. Do you want to?
Anyway, okay.
Especially on the gift certificates in terms of the agenda. If there's something maybe we can share later on that we can post or share with them, that'd be great. On the gift certificate, how much, who, target businesses, and the role of the task force on the agenda.
Actually, let me go back to my oh, sorry. I was trying to get back to the Zoom and well, as we talked about, we have some areas where whereby we have specific gift certificates that are going to be designed, but this is still in its infancy stages. So the timelines that we have August to January. That's the time that we have. But within this time period, there are some areas whereby we have the to support in the programs, support education and mobilization. So these are the people whereby we're going to have people that will be given certain incentives to do this kind of work. And these kind of certificates will be in terms of in the denominations of $50 and $5. I mean $500, and requesting people to be able to produce specifically on their deliverables that we would like to have. And as you can see, as I was going to share the timelines, my screen could not come up. But if we do, we will have to use the selected businesses in the local areas. These will be like the Visa cards, which can be in terms of cash, or we would have discount programs from like Safeway or Target, and other many areas that we need to have in terms of where we see can that be a good thing for the community to use or to really to engage into the vaccination program that we're trying to do at the outreach. So, but as of now, we have not signed up any contract for these particular certificates, in which we're going to do it in due course. But again, these particular program and the group will be in charge of making the decisions and authorization for these certificates when it is time to give them out.
Okay. Thank you, Mr. Dungu. You're right that, really, this is the, again, the community being this community, this group help to make that decision. Again, in the spirit of Ubuntu, we're all in this together. I know the idea of certificates or incentives may be mixed in some quarters, depending on how you use that. A couple of days ago, we had a very robust discussion with Mr. J. King, about that. But what do you all think generally? Two questions. The idea of gift certificate, we kind of touched on it a little bit earlier on in terms of the survey. So it looks like, we all in the same page. That is a good thing to do. But the two questions will be, how much do you think it should be that you think will be enough as an incentive to get people to do whatever it is that we like them to do in a compassionate, kind, effective way? The second is the idea of targeting Black-owned businesses. Should it be 100% or some fraction of Black-owned businesses out there? So let's take it into the first question. What do you think in terms of the amount? What amount should it be? Up to $50. The grant allows us to go up to $50 in this type of incentive, unless we have some strong justification to go beyond that. But now up to $50. What do you think? Thoughts?
$50 should be okay. I just have a concern. There's something I'm not hearing regarding this gift certificate. Let me turn on my video. Regarding this issue of gift certificates, are we going to link this with them getting the shots, or we just want to give it to them after they attend the seminar or information session? That I didn't hear.
Yeah.
Because if we just give the gift to them without them linking it to the first shot and the second shot, I don't think it's going to be effective. So I want to hear a little bit more about that before we start talking about, is it $50 or not?
Yes. Yes. That's the question of what for. That's part of that discussion. If we say $25 or $50, it can be all of that both, right? From coming to an event and having them complete a survey, for example, or answer a question, whatever it is, some interaction to possibly getting the job. And should we be the same or different amounts? So
I think $50 is fine.
Yeah.
Okay, thank you.
Mr. Tambo.
Yes, please go ahead.
Yeah, I would say, well, as a member of the community, I would say it depends. Because, and so I like your answer, Dr. Mwazie, that all of the above might work. Because, for example, Dr. Taylor's story about the PhD person who passed away, I don't think if I give $30 gift certificate to her in her capacity as a PhD or aspiring PhD, that will not entice her. So that might not be necessary. However, I did talk to like the Dr. Tansins. They have their own medical business in Stockton for over 30 years or 40 years. What they suggested is that the person should get a job first. They will come to them, they will talk to them, go and get a job. And then when you get it, come back to the clinic. We have this gift certificate from so and so, then they give it to them. So it will have direct correlation with the job. Then, I mean, with the, what's it called, the vaccine. So that could work.
The job is fine.
Yeah, so we can track it too. So at least if I'm monitoring, I can monitor it from that angle that, yeah, the effort lead to a job.
Okay.
And some of the areas, as you said, Vice President Kwame, it is when we give an incentive, it's like trying to value what we're trying to do, not so much of the incentive to the person. For example, like when I worked through, when I I served on the Interfaith Council of Greater Sacramento. They wrote a check to the Africa House. And this check wasn't really something that it was so much of a worthy to be, for me, after serving for 10 years. But Africa House was recognized in the interfaith as an organization that is coming up. That is the purpose of this gift certificate. And when you give a person $50, it's not so much that the person cannot, can't get more money, or it's not worth his efforts or her efforts, but it is about trying to recognize that person's presence and action that she has done, and that's what we can afford given the grant amount.
Okay, thank you very much, Mr. Dungo. Dr. Sebuna, it looks like you want to say something, and then Dr.
This is Dr. Kindawara.
Dr. Barata, and then Dr. Febuna, you wanted to say something. Yes, Data.
Hi, can you hear me?
Yes.
Oh, thank you. Just two quick comments. So the amount 50 or 75, ideally maybe 100, but I don't think the amount would make an absolute big difference. Generally, my thought would be the bigger the better. So if there is a budget in money in the budget, so maybe 100 would be my preference. But more importantly, probably building on the previous speaker's suggestion, I wonder if we can also, again, if there is money in the budget, set aside a certain amount to the organization or an organization, or say community center, Nigerian, Ethiopian, Ghanaian community center. So let's say they persuade or recruit 10 people, 5 people per person, a certain amount, maybe 50, maybe 25. So instead of just giving it to individuals only, I wonder if we can set aside some amount to the respective communities. So that is one. On the second issue of whether it is 100% or 90% or 50% Black owned, I think any percent Black owned, obviously 100% would be first priority, but any percent, any business where a Black person is at least a part owner, I think we should try to reach out. Thank you.
Thank you very much. Okay. Dr. Febuna, you want to say Wayne and Dr. Mosupia too, please?
Actually, I was just working on something and accidentally raised hand, so no.
Okay.
Yeah.
Dr. Mosupia, you want to weigh? And Ms.
Yeah,
Nasuna?
I don't want to repeat what people have said, but I think what Data just said, it's really a good idea to think beyond the individuals and also think of a certain amount to the organization. And then, yes, I do agree that linking the message with the amount is good. And if we do it 75, 50 is fine, 75 would be better. Thank you.
Okay, thank you. We can, for this part incentives, we can go up to 50. Going beyond that would justify extraordinary requests, and which we can avoid. But we can go up to 50 in that regard. Anybody else like to weigh in on this? Otherwise, I'd like us to move to the next. I think, and please,
Yes, Dr. Kindawara.
Okay, please.
Sorry.
Go ahead.
Yeah, I have a question. Help me understand when we say whatever the incentive we're giving, is this part of the when we're reaching out or after somebody gets the vaccine? Help me understand. Maybe I missed something that's already been said.
Yeah,
my fear is that we know our community, and in order to increase, our goal is to make sure no African or no Black person is left behind, right? So I'm thinking, is how we're gonna approach this? Are we gonna be having the vaccine with us, or whatever? If we bring the hospital, whatever group coming to an event and meet people and try to to have a speech, convince them, and be able to, we can get some people right there and get vaccinated and give them an incentive. Because I'm afraid that if it will be given during the raising the awareness, people will get the money and they will not get to the intervention part. So help me understand. Maybe I missed something.
That's the whole idea, to raise these questions. At some point, I will, probably meet with Mr. Dungo. This is an area in his area of operation to kind of. I'm hearing two things. One is the concept of using gift certificate or incentives is fine, is good, but being able to target that to some deliverables that will relate to our deliverable, right, is important. Which is, it's not just getting the money, but the proper education and awareness that will lead to the vaccination or the precautions still needed. Even if you're not, vaccinated, or even if you are vaccinated, right? That's the precautions needed. Targeting Black-owned businesses, is definitely one that seems to resonate. Maybe a majority of those gift certificates will be from Black-owned businesses that we can identify where we know people can actually use, like food, for example. And maybe we'll have two sets of amounts, one for the maximum amount of getting the jab, which is $50. And maybe the other ones will be like $25 or $30 or less than $50, that we can give out a bunch of them to the leaders of the different organizations in the community that we are using, with some specifications in terms of giving out such gift certificates, and making sure that they're properly accounted for. Each representative of the different organizations here will be paid $500, and you have the option of that yourself or giving that to your organization. At some point, we may regroup and see where, in terms of the budgeting, we need to make any adjustments, in that regard. But the current thinking is, budget about $5,000 in incentives for gift certificates, maybe between $25 to $50, and distribute them in terms of those who come to the awareness events that we do directly, or any of our partner organizations will do, and will make a decision as to how to divvy them out and how to properly account for them, and provision for possibly getting the jab. So it's as inclusive yet meaningful as possible, in that regard. So in our next meeting, hopefully in the next couple of weeks, we'll probably give you what that plan may look like as well. And again, we're very mindful of the fact that we should not lose sight of the price, which is getting the vaccine, being safe. The money helps us as an incentive. But the life and health of the individuals and the community remain our primary goal. So can we also tie the recipient of this incentive to including? Yes, I think that's what I said. Maybe we'll have two that would include getting the actual vaccination. Yeah. So, Dr. Duru, do you want to speak quickly about the field operations now, or we go to Dr. Adeni on the guest speaker series?
Go to Adeni.
Okay, Dr. Adeni, please go ahead on the speaker series, please. We have barely 10 minutes left, so let's quickly go through this. I really like the discussions where we are having. And Ms. Inyang, I have this inspiration because you have been willing to volunteer and step up to say if you can lead us on the kickoff for September 4th. Dr. Adeni, please.
Yeah, so in terms of the speaker series, I think a number of people brought up some good points in terms of what things we need to address, whether it's, once again, addressing the misconceptions or the myths associated with the vaccine, or looking at specific groups. One of the things that I thought about is obviously participating in the series, talking about what's happened with the Delta variant and how things have changed with that, but also looking at including infectious disease specialists who can speak more to the prevalence of the disease, epidemiologists and public health researchers such as Dr. Kasiri to speak to the public health impacts, and then hospital medicine physicians who have had to take care of individuals in the hospital who have been suffering from the consequences. One of the other areas that I think might be helpful is there has been a prevalence of people that have been concerned about their fertility. So looking into OB-GYN and having them speak to what the ACOG has talked about in terms of the public health, in terms of the risk or the lack of risk associated with COVID-19 vaccine versus those who get pregnant and get COVID-19. So those are some of the thoughts that we've had. I've presented to my staff on more recently in terms of how the Delta variant has changed our approach. And I think that could be helpful, but I'm definitely willing to hear what other people think would be helpful to speak on. The goal is for us to have these talks be less than an hour, because most research says that 50 minutes is like the max people are going to pay attention to something. So if we could find ways to get those messages out and then replay them throughout the week, or if we decide that it's weekly, I'm not of the thought that weekly is necessary, but if we decide that it's weekly, that we have dynamic speakers that can participate in the conversation.
Okay, thank you very much, Dr. Adeni. Any thoughts? Yes, the goal is to have kind of a series of town halls, kind of standings that we know is there on a particular day and time. I think an hour. You know, Dr. Adeni will be coordinating that, but it doesn't mean that he will be the only speaker. So there's a question: can we include other speakers? Yes. Dr. Adeni is coordinating that. Feel free to make any such suggestions, and of course the AMPA relationship, Dr. Salako. Can we partner with other CVS? Yes, that's really part of the grant, is to support like any vaccine clinics out there. So in addition
Dr.
to
Wazi,
the yes.
I was going to also add, I think it's important, we're looking at the platforms that people are communicating with. Sometimes we show our age when we talk about, kind of these town hall structures, as opposed to digital platforms that will exist long after the, the 10 or 15 minutes, the most profound, most effective tools you see on YouTube are about 10 or 15, maybe 20 minutes at the most. And they exist after the initial presentation. And I think that we have to leverage this opportunity. We have to leverage this money that has been, this possible grant that says, how do we, that which we are doing, can it exist long after this grant, after we've satisfied this grant? Will it exist on a platform where in very digestible ways that many of, and I think we have to look at the age numbers, and they're all in that kind of millennial group, that early 30s. Yeah. And they're not digesting town halls. They're really kind of looking at stuff on their own in the confidence of their own YouTube and Twitter and all these other platforms. And I think the how is as important as the what here. And if we miss the how, then we miss a lot. And so I think we have to talk to Dr. Taylor and his group, and I'm sure he would consort with his younger millennial, some of his professors and younger staff, about what kind of platforms can we take advantage of where this information exists after, where it becomes viral, where it has life. And I think that the question of how is as important as the what when we're talking about this. Yeah. So that's my 2 cents there.
It's more than 2 cents. I agree with you. And we'll definitely, and Dr. Adeni is listening, and definitely kind of, would think about that, be very, very conscious, of that as well. I really promise that we'll keep this meeting to time, and we have barely 5 minutes left. I would like us to kind of begin to think of bringing to closure. September 4th is the kickoff. We have not decided on time and location. If anybody has any quick thoughts, and I'm going to use the opportunity to have Ms. Ubong Enyang, if she can help us take a lead in putting that together for us. And then maybe we think of our next meeting. I'm kind of thinking August 25th, in a couple of weeks. And for about an hour and a half on some key major items that we can bring some closure on. So when you kind of think about what does 5 to 6:30 p.m. look like for you on August 25th. By that time, we would have received the feedback on the campaign message or slogan, and we'll get a good sense of what that kickoff on September 4 may look like, and then have some clarity or conclusion on the gift certificates, what, why, and how. Okay.
At least not 5 o'clock. It's a weekday, so at least if it's 5:30, you give people the opportunity to get off from work and then sign on time. So
okay, yeah, that works for me. Like 5:30 to 7. We try to get to that time. Okay. In terms of location for September 4 kickoff, what do you think? Something tells me that we'll do it in one of the deep communities in the 95823 or 22, where we have the high rates, where we have the heart and soul of the Black community, Oak Park, Meadowview areas, or elsewhere, where possibly we may have a mobile vaccine clinic that could come out, and we have different activities, speakers, some artistic presentations, and speakers from the different communities and organizations. And of course, we can't go wrong by having food. All right. Outdoors, being mindful of the CDC guidelines in this regard. What do you think in terms of location? Any quick thoughts on that? Dr. Adeni, I hear you in terms of Twitter, YouTube, LinkedIn, and so on and so forth. Yeah. Okay. Yeah.
This is Alex.
Yes, please.
I agree. Yeah, Oak Park in that area is a good selection. Even the actual park itself, it's a good option. I concur, and also really do taking advantage of social media. 15-minute clip might be a little bit long. A lot of people look at it and see how long it is, but if it can be made bite-sized, so you can have a link to a link, right? You have the bite-sized one that catches their attention, and then it goes into the bigger link once they've been captured. So something to consider.
Thank you very much. Okay, I will, Miss Enyang, we can talk more later on and communicate by email in terms of any thoughts and ask for further input or contributions that, but definitely by the time we meet on that August 25th in a couple of weeks will be a major agenda item, what that could kick off of September 4 would look like. Okay. Thank you very much, Celeste Carolina. Thank you. Okay. Does anybody feel compelled with anything that, gosh, I wish I said it? Please use the chat as we get to the closing prayer. Use the chat to please express any thoughts, additional thoughts, suggestions, or questions that we can follow up later on and address or the next meeting. Dr. Ofebuna, please connect with Dr. Adeni, and definitely Dr. Salako is here as well. I think we can use a lot of speakers in terms of the education component of this project. So
great. Thank you.
Thank you. Go ahead, please.
No, just confirming, thank you that I certainly have been doing a lot of campaign on COVID-19. So I feel like we have people that we've been using to do the outreach and things that we've done. And so like you advised, I will connect with Dr. Adeni and let him know the resources that we have.
Thank you very much. And thanks, Ms. Cecilia Ojungwa, for her able work as our admin, helping us, get this managed, well, getting the information out. And I know it's been a little bit of a stress doing that as much at the last minute, but thank you very much for delivering.
My pleasure. Thank you so very much, everyone, for being here.
Thank you very much. Each and every one of you coming, please, thank you very much. And others that you think could benefit from this gathering at our next meeting, please invite them. And you can email me directly and or to Ms. Ojingwa or Mr. Tambo or Mr. Dungu, and we'll make sure that we include them. Any group that you think would add value in terms of what we are doing. Appreciate that. Paperwork wise for payments with Mr. Dungu, that's his shop. So make sure, Mr. Dungu, that we get the necessary paperwork for people to make sure that they get paid accordingly. Mr. King, I know you said you're going to come and observe. We can follow up later on. And any thoughts or ideas? Thank you for joining us as well.
It's my pleasure. I'll join again.
All right, thank you. And young Kelechi Okebu, we can talk later on in terms of your observations as well and how you can be a partner as well. Mr. Austin, Julius, is that, yes, you want to lead us in the closing prayer or?
No, I just wanted to add, I just also added it into the chat. There's some opportunities to partner with Sac County Public Health to take advantage of their resources to do provide pop-up and mobile clinics. And so you can contact me and I can put you in touch with the proper contacts at Sac County Public Health.
That's great. Thank you very much.
Can I squeeze in that, Dr. Adeni? I have a message chat directly with you. Please respond. Thank you.
All right. Can somebody lead us in the closing prayer? Please, again, it's interfaith. Nobody left behind. Please, if the Spirit moves you, step up. And our next meeting will be August 25th, 5:30 to 7 p.m. And you'll be getting a reminder and agenda prior from our very able admin manager who's acting. In the program, I indicated we have open positions for a program admin assistant, somebody to help us with the communication, and also as outreach specialist. And these are all paid positions. Follow up with me later on if you know somebody interested or any prospect. Please, we're about 3 positions. Okay. Closing prayer, anybody?
Let me pray.
Okay.
Father, we thank you for today's discussion, oh God. Father, we thank you for giving us such a knowledge, idea, and wisdom that we will be able to move our people forward, oh Lord. Father, we ask that you continue to encourage us and give us like minds and heart, oh God, to do the best we can for our people. We bless your name. In Jesus' name we pray. Amen.
Amen. Thank you very much. And Reverend Moore will pick up later on in terms of the outreach to the faith community as well. And I'm sure you will bless us more in the process.
No, Prof, I didn't hear you, sir.
I said I will reach out to you later on in terms of the faith community as well.
Okay, please, I'm very sorry. I'm clashing with two
meetings
at the same time. In fact, they just called me now to speak. I finish and then come in here. I'm sorry.
Please go ahead. Yeah, please go ahead. Yeah.
But
you're welcome to stay if you all want and if you have so many exchanges. Otherwise, this meeting has concluded, and I thank each and every one of you for your contributions until we gather again on the 25th or email communications that may ask for your response. So spread the word. Thank you.
Thank you, Dr. Wazir. Wonderful job. Thank you, everybody.
Thank you, everybody.
Bye-bye.
Thank you, everyone, again. Thank you.
Thank you.
Because you want to stay behind a little bit?
Sure, sure.
Okay.
Dr. Uwazi, I'm still here. I wanted to ask a question.
Yeah, go ahead.
I thought Blair had accepted the position of admin assistant.
No, she stepped down. I had sent an email to that effect.
Oh,
she
did?
Yeah. Last week, I think a couple of days after she stepped in, and she withdrew, stepped down.
Oh, okay.
Yeah,
Great.
yeah, and I had forwarded her email to you and the rest of the executive team earlier.
Oh, okay. I'm sorry, I missed that. Thanks.
That's okay. That's okay. I know it's a lot of communication. So yeah.
Okay, have a good day.
You too.
Thank you, Evelyn.
Okay, bye-bye.
Bye.
Okay. What do you think?
I think it went well, and it's a good thing. Let me stop the recording.